The widespread use of CT scans in modern medicine has undeniably transformed diagnostic capabilities, enabling rapid and precise detection of internal diseases, injuries, and abnormalities. But as these scans have become increasingly routine, a growing body of evidence now highlights a risk that is no longer possible to ignore. Exposure to ionizing radiation from CT scans may be contributing significantly to the overall cancer burden in the United States. A recent study conducted by researchers at the University of California, San Francisco, estimates that 5% of all cancers diagnosed in the U.S. each year, roughly 103,000 cases, can be attributed to CT scans performed in 2023 alone. This is not a speculative concern. It's a modeled projection based on updated national data and validated risk estimation frameworks, and the implications are deeply troubling. While CT scans are undeniably useful, what's often lost in everyday medical practice is how easily they're prescribed, frequently without adequate consideration of long-term risks. This casual reliance on high-radiation imaging isn't just a matter of convenience, it has serious consequences. For many patients, especially those in vulnerable age groups like children and the elderly, the exposure can result in a heightened lifetime cancer risk. The study notes that babies under 1 year of age are up to 10 times more likely to develop radiation-induced cancer compared to others. That is a harrowing statistic that deserves far more public attention than it currently receives. One of the most dangerous aspects of this issue is how invisible it is. There's no immediate sign of damage from a CT scan. Unlike a medication that might produce an allergic reaction or side effects within hours, the harm from radiation exposure is insidious, often taking years or even decades to manifest. This delay creates a false sense of safety, encouraging a better safe than sorry mindset in which clinicians order scans to rule out worst-case scenarios, even when the likelihood of finding anything actionable is low. In reality, this practice trades short-term reassurance for long-term risk, which may not become apparent until it's too late to trace back the cause. Even more concerning is the fact that the doses patients receive from CT scans are often much higher than necessary. Despite the availability of dose modulation technology, not all imaging centers use it properly or consistently. A single type of scan, like a brain or abdominal CT, can vary in radiation dose by as much as a factor of 80 between institutions. In many cases, patients are exposed to radiation equivalent to thousands of dental X-rays in just one scan, and most never know it. This wide variability in practice is not due to technology but to the lack of regulation and standardized protocols. In a system where oversight is lacking and commercial incentives may prioritize throughput over caution, patient safety is too often compromised. This study also calls attention to the phenomenon of low-value scanning, CT scans that offer little or no diagnostic benefit. These can stem from defensive medicine, workflow efficiency pressures, or simply habit. The problem is not just overuse but misaligned incentives and an absence of strong institutional accountability. Initiatives like Choosing Wisely have tried to combat this trend by encouraging more mindful imaging, but the uptake has been limited, and the medical culture still leans heavily toward more imaging, not less. What makes this particularly alarming is that alternatives often exist. Ultrasound and MRI, for example, offer high-resolution internal imaging without ionizing radiation and can often be just as informative, especially for soft tissue or vascular assessments. Yet CT remains the go-to option because it's fast, cheap, and widely available. But speed and convenience should never eclipse safety. The tendency to default to CT imaging without thorough consideration of alternatives not only puts patients at unnecessary risk, but may also desensitize both providers and patients to the gravity of repeated radiation exposure over time. The medical community has long known that ionizing radiation can cause cancer. But knowing something in theory is very different from seeing its real-world consequences at a population level. The UCSF study's findings force us to confront that disconnect. While some critics note that the research is based on modeling rather than direct patient outcomes, this is how early warnings typically emerge in public health. The dangers of tobacco, asbestos, and lead exposure were all first recognized through statistical modeling long before definitive causation could be established through long-term observation. To dismiss these projections now would be to repeat history's mistakes. Another critical point is that many cancers potentially linked to medical imaging may never be recognized as such. Due to the long latency period of radiation-induced cancers and the fact that people are exposed to numerous environmental and lifestyle risks throughout life, it's virtually impossible to pinpoint a specific scan as the cause of a specific diagnosis years down the line. That uncertainty is often used as justification to downplay the risks. But the very absence of visible causality makes the threat even more dangerous. It allows risk to accumulate quietly and unnoticed. The burden of vigilance should not fall solely on the patient, yet in today's healthcare environment, it often does. Patients are told to trust their doctors, yet they are rarely informed about the dosage of radiation they're being exposed to, or even that the scan involves radiation at all. In an ideal system, providers would always ensure that every CT scan is truly necessary and performed with the lowest possible dose. But until that becomes standard practice, patients must take on the uncomfortable role of advocate. They must learn to ask questions like, is this scan essential? Can a non-radiation alternative be used? Is this facility using a low-dose protocol? These are not questions most people are prepared to ask, but they are vital. There is no question that CT scans can save lives, especially when used appropriately. But that doesn't excuse their overuse, nor does it negate the responsibility of the medical community to reform current practices. Radiologists and referring physicians must be better educated about the risks. Imaging centers must be held to standardized dosing guidelines. And regulators must establish national benchmarks that ensure radiation exposure is minimized across the board. In the end, this issue is not about rejecting CT technology, it's about respecting it. These scans are powerful tools, and like any powerful tool, they require precision, restraint, and responsibility. Without those, the unintended consequences will only continue to grow, quietly contributing to a cancer epidemic that could have been, at least in part, prevented.